Welcome to Great Ormond Street. I'm one of the Band 5s on PICU. We want to show you why we love working here and why you should apply for a job.
So I came here newly qualified. I did my final placement here whenever I was a student. I just really like the variety here compared to the wards, which are all really specialised.
You do have patients pass away, but I find that it's the teamwork that gets us through it, and the debriefing and just general chats and the occasional drink after work with the whole team.
Yeah, there's a lot of support here from our matron, other senior nurses, our friends, domestics, just everybody really works together to make sure that difficult shifts are made that little bit easier.
And everything runs smoothly, even when it's not.
So I quite like working in intensive care because it offers me something that I think a lot of the other wards haven't offered me in my career so far, that I quite enjoy the variety and I quite enjoy the more intense speciality. There's always something new, there's always something academic to learn, and since that I've done quite a few courses on PICU, and one of them being the intensive care course, which I'm in the final module of at the moment.
I think throughout the course it's been really great because all the senior staff have supported us so much. I don't know how you feel about it, but it's been really good to kind of get all this knowledge and consolidate everything that you've learnt on the course, and I'm really looking forward to coming back onto our unit and kind of having a head full of knowledge and to put it all into practice over here.
Finishing it and consolidating afterwards.
Yeah. Alright, hi, I'm Lizzie. I work on PICU as a Band 6 staff nurse, senior staff nurse. I've been here for 4 years. 2 years of that I was a Band 5, so after I'd done my intensive care course I progressed into my Band 6 role. It's great here, so come and work for us. It's a really good role here at Great Ormond Street, so it's a very busy hospital, the patients are really diverse, and the Band 6 role here, there's a lot of opportunity within the role to take lots of different pathways to things of interest actually. I developed working with CVVH or hemofiltration, so we do that as part of our intensive care course here, but I've just developed confidence with it and signed off various competencies and got to grips with troubleshooting, and I'm now a primary checker for CVVH here. So that's quite a big thing to get your head around initially. Also, once you've done the intensive care course, you take the crash bleep within the hospital. So if there's any clinical emergencies in the hospital for a child or for an adult, this bleep will go off. And we attend the arrest, so there's a big team of us that go. We're often responsible for drugs and fluids, but there's other roles in the arrest as well. So we meet a doctor there and the clinical site practitioners to help manage and organise the emergency situation. Following that, we also get to work with the Children's Acute Transport Service, which is really exciting.
So I remember when you were doing your rotation as a Band 5 here, Kirsten.
I know, I only came for 6 months and that was 10 years ago and I've never left. So I think you just know very quickly, don't you, if you want to be an ITU nurse for a long time or not, and I did. And I've gradually worked my way up through Band 6 and taking charge of the unit, and now to be in a Band 7 and having my own team. So I think there's definitely a lot of opportunities on PICU. Wouldn't you agree, Anne?
I think similarly. I only came for 6 months and I've now been here 7 years. I think the rapid transition through all the experience that you've given is fantastic, and the support. From day one you feel like you're inclusive in a team and you're supported all the way through, and you're always encouraged to take that next step, which is really important for your own development.
And I think to begin with, sometimes it can feel quite scary being part of such a big team of people. But actually it means that you always have somebody that you get on with and that you want to spend time with, and that you can do social things outside of work.
It's really important that we all still work clinically as Band 7s, because it's important for us to be able to support the Band 5s, because we've been there. We know what it's like to be them, don't we? So I think it's really important that we still work clinically, still get involved and still seen to be visible on the unit.
So I think one of the most important things that we as an education team can bring to the unit is when we do our weekly Wednesday teaching with the doctor nurses. It really helps with the relationship between the medical team and the nursing side. The consultant is present and he's doing a lot of the theory side of the teaching, and then one of the educators will then do the practical side of the teaching and demonstrate the skills that we need for setting up examples of arterial lines or chest drains, which is obviously really important because then it gives everyone more confidence for bringing that back onto the unit.
Hi, I'm the matron here on PICU at Great Ormond Street Hospital. Due to our continued expansion, we're looking to recruit nurses to work here on Paediatric Intensive Care. Our PICU is one of the largest intensive care units here in the United Kingdom. We offer intensive treatment and support for a variety of children of all ages and look after children with illnesses from asthma to post-op surgery to those suffering from neurosurgical emergency surgery. Every day is different and no 2 hours are the same. Are you looking for a challenge? Come and join us.
I'm sorry, oh no, I ruined it.
These aren't even my trousers.
We're on a time.
They're coming up to like here.
What do you think's the best question to start it?
I thought I would be great on TV, but I'm dreadful.
Are we starting?
I think it's time.
Oh, okay.
So I quite enjoy intensive care because I've just moved my hands off, sorry about that. Start.
Welcome to Great Ormond Street PICU. We want to show you why we think you should apply for a job here. That's so difficult to say.